Well, happy Wednesday afternoon, everyone. Thank you so much for joining us. If you haven't joined us before, my name is Michelle. I'm the outreach coordinator here at Pasadena Humane, which means one of the wonderful things that I am able to do is host these online webinars for you. Today, we are joined by the amazing Dr. Pyrdek. How are you today?
Doing pretty good. Excited to be here.
Oh, I'm excited to have you here and hear all the wonderful information that you have to share with us. And just so everybody knows, not only is Dr. Pyrdek one of my coworkers, but I also get the experience of working with her as a veterinarian because I foster a lot of kittens and some of them have needed some extra attention, and she is just the lady to help me through all of these situations that can be a bit scary. So hopefully today we will hit on some of those situations that hopefully you may not experience, but you'll have the knowledge if you get to experience them. Okay. So before we get started, I am going to go over a few webinar reminders with you if you haven't been with us before. Okay, so I'm going to share my screen with everyone. Okay, and so seems like the internet is taking its time today. Okay, so these webinar reminders, just so everybody knows, this is an audio visual presentation, so you are automatically muted. You can see and hear us, but we cannot see nor hear you. With that in mind, please ask your questions using the chat box on the right-hand side of your screen, and we will get to them as soon as it is available. So if you can, save all of your questions to the end, but I do know that sometimes questions just pop into your head and you've got to get them down, so go ahead and do that. Today's webinar, we will be talking about cat and dog first aid. We've got another free webinar coming up in a couple of weeks. We're going to talk about the difference between therapy animals and service animals, and we've got a representative from Pet Partners joining us. We will also be celebrating Meow the 4th this year, which takes place on a Tuesday. We're going to have renditions of Baby Meowda and Chewbacca, and we're going to be talking with producer, screenwriter, and all-around Star Wars enthusiast Mark E. Riley about the animals of Star Wars and their influences. Your painting supplies will be sponsored by or come from Blue Rooster Art Supplies in Eagle Rock, and your wine for your sipping pleasure comes from Everson Royce Wine and Spirits here in Pasadena. We'll have a Chardonnay and a red wine for you to purchase. This webinar is recorded, so if you miss anything at any time for any reason, or you just want to go back and see Dr. P and I, then you'll be sent this webinar tomorrow afternoon. If you enjoy watching this webinar and you want to make an impact, you can use this donation link below, and I'll go ahead and drop that in the chat box. And all of your donations in the month of April will be doubled up to $50,000. Okay, and without further ado, take it away, Dr. P.
All right, give me 1 second to start sharing my screen. There we go. Okay, so as Michelle said, I'm Dr. Pyrdek. I work at the Pasadena Humane Society, and we're going to talk about pet first aid because while we always hope for the best, it is always important to be prepared for the worst. So we're going to start pretty basic with just a general definition of an emergency, which is unplanned, usually pretty scary event that requires immediate action. We've all been at home, probably a lot more than usual in the past year when suddenly the unexpected happens. In the vet clinic, we can see all kinds of emergencies, everything from a dog who is just hit by a train to a kitten who jumped in the recycling bin and cut his tongue on a can of tuna, to sometimes even a dog who's just looking at his owners funny and maybe squinting his eyes a little abnormally. And so while some of these are very clearly emergencies, and some maybe not quite so much, they all really share some common threads in that they're scary, and there are definitely actions that owners can take in the first couple minutes that can sometimes make the difference between life and death. So for the next 40 minutes, we're going to spend some time preparing a little bit of background knowledge for how to handle an emergency. And honestly, there's no better way to prepare for an emergency than having already experienced an emergency. And so here I put up one of my personal pets, Silver, who experienced many emergencies and helped me to learn a lot about what to do in the case of if your dog happens to get shot a couple times or falls off a 150-foot cliff. Both emergencies and both definitely experiences that I learned from so that I can help many more pets in the future. I do really enjoy working through cases, and I really like to teach and educate people about what to do. But I do want to throw up a little disclaimer that the information that we're talking about today is a guideline for you to learn what to do in an emergency situation, but it cannot replace emergency visits to your veterinarian. And if there's an emergency, you need to call your veterinarian or your local emergency hospital, and do not rely on anyone on the internet to help. Trust me, coconut oil, turmeric will not fix a medical emergency. We've seen it in the clinic. It will only make your dog greasy. There's also a note of warning to any squeamish viewers. This lecture is going to use videos and photos that show actual emergencies and actual situations. So there will be blood, there will be abnormal neurological episodes, and other upsetting or potentially upsetting images or videos that we're using. I'm going to try to alert you before these come up, but the purpose of these videos is to convey what you're going to see in a real life case. So we're going to keep it fun and light where we can, but we're also not going to shy away from the realities of what you're going to see in an emergency. So the very first thing that you can do in being prepared for an emergency is to create your very own pet first aid kit. Hands down, the most important items that you have are going to be the phone numbers and your pet's medical history and vaccine history. And I really, really stress that you should write these numbers down. You might know your pet's history, but emergencies tend to happen maybe when you're not right there next to your pet. Your pet sitter is not going to have access to your pet's medical app on your phone and may not know everything about your pet's history. Emergency veterinary clinic numbers should also be written down. It's really helpful to know in the moment exactly where you're going and where you're going to take your pet if you need to. And then two numbers that are good to know exist, I also recommend writing them down, is an animal poison control line or the pet poison hotline. Both of these numbers are open for veterinarians to call or for a member of the public to call. You can explain if you're worried that your pet has gotten into something, and then they can talk you through those initial steps of what to do for that particular exposure. I, again, highly recommend writing these down, printing it out every time you take your dog to the vet's office, so then you can add this to your file and you have it when you need it in the moment. And then some items that you should add into your pet first aid kit. A lot of these items will overlap with a human first aid kit, so make sure you have a good human first aid kit, but a few items that are a little bit more particular to pets. Some of these are going to include rolled gauze, really important for creating some bandages. A good pair of tweezers for removing bee stingers, cactus thorns, any sort of foreign body that might be stuck in the skin. Some non-stick bandage pads, so you could bandage and place this over a wound. Some adhesive medical tape, which will help to actually put your bandages on. Regular sticky band-aids don't stick to fur very well, and they don't put pressure over a wound, so you really need to have the bandage material you can apply and wrap around a wound. A digital thermometer, a dog and a cat's temperature is on average normally between 100 and 102.5. So they run a little bit hotter than humans. And so when you're adding a thermometer into your first aid kit, you want to get a digital thermometer that's calibrated for fever. So it's more precise at reading the higher temperatures that a dog or a cat's temperature normally is, as opposed to a human temperature just closer to 98.6 degrees. Milk of magnesia can be really important in helping to prevent absorption of certain toxins once they've been ingested. But you need to make sure you're checking this regularly because there is an expiration date, and an expired drug can sometimes be just as dangerous as the drug that or poison that your dog may have ingested initially. And then hydrogen peroxide, which is also used as a vomiting agent, can also expire. So we want to make sure we're checking that regularly as well. I do highly recommend that you keep a muzzle in your first aid kit. When dogs are painful or scared or very nervous, the first thing that they're going to try to do is bite to defend themselves. So even though your dog loves you or your cat loves you and wouldn't intentionally hurt you, when they're really painful, you just don't know exactly what they're going to do. So you want to prevent them from doing something they don't really mean to. And then last but not least, highly recommend just keeping an extra leash, especially a slip leash like this in your first aid kit, because you never know if your husband or your brother or sister may have left that leash directly on the hook where it usually is. And in an emergency, you want to make sure that you have something that you can grab and you can use right away without having to look for it. And so when you're approaching emergencies, there are definitely things that you can do, which are very important, and there are definitely some things that you should not do. So some of the things that we really want to make sure that we're doing, we want to be calm. Really important to set the tone, and if you're panicking, you're not going to be able to make calm decisions. Don't hesitate to muzzle your pet if you think that this condition is painful or your pet is starting to panic. If you get bit and you get hurt, you're not going to be able to help your pet. Don't be afraid to wrap a towel or a blanket over a smaller pet. It can help protect if the cat is trying to scratch you or is nervous. And so keeping them covered and wrapped up in a towel can be really helpful to allowing you to look at your pet, as well as move or carry them around if they're really panicked. You want to make sure that you're approaching your pet slowly and examining your pet slowly from head to tail. Don't go directly toward whatever part you think is injured and move very quickly. You can startle your pet when they're already nervous and make the situation worse. If you're transporting your pet, it is important to confine your pet. If you have a dog who's in the car, who's maybe having a seizure, you don't want them to have another incident while they're in the car and then fall off onto the floor and injure themselves any further, or be running all around the car panicking. You want to be able to focus on driving and getting to your destination safely. And then a quick PSA just from the vet clinic side, you can use a carrier, but we really like, especially in emergency situations, when you're using carriers that open from the top or a top that's very easily to be removed. A cardboard box can also work. If you have to reach into a really narrow door and pull a pet, especially a cat, out the front, it can be really stressful for the cat and can sometimes cost valuable time when we need to see your pet right away. Take your records with you. This goes to having that first aid kit and being prepared, but a medical history can really help to determine sometimes exactly how to treat a pet who's having a medical emergency. And this might seem obvious, but don't forget to give your pet sitter records before you leave. We see a lot of animals that come into the emergency room with pet sitters who don't have any idea about the medical history of their pet that they're watching, because the owners have just left and didn't want to come across as an over-attentive pet owner. The more prepared you can be, the better it's going to be for your pet if an emergency situation arises. A few things you definitely don't want to do if your pet is experiencing what you think might be an emergency. You don't want to hug or kiss your pet to try and make them feel better. If they're scared or they're nervous, hugging and kissing them won't necessarily make them feel better. Instead, they see you coming at their face, they may feel claustrophobic, and so they can bite and they can hurt themselves or hurt you. Don't yell or scream. You're setting the tone, and your dog or cat is taking cues from you for how to react in a situation. If you're getting really worked up and running around, then your dog or your cat is also going to start getting more worked up, which can make their condition much worse. So don't be hysterical. And then don't try to deal with serious injuries yourself. There are definitely situations where you can look at an injury and you know that it needs medical attention right away, and it is not worth spending a lot of time trying to MacGyver a splint at home. Just pack your pet up and go to the clinic right away. Let them get the medical care that they need. So some cases are very obviously an emergency. A pet who's just been hit by a car, who's laying unconscious, needs to go into that vet right away. A small dog who's picked a fight with a larger dog, who's laying unconscious, needs to go immediately. You don't need to spend much time assessing. You need to go directly to the vet. Do not pass go, and do not collect $200. In other cases, there are a few things that you can do that can be done very quickly and usually pretty easily. One of the first things that you're going to do is assess the mentation. How does this dog look? Is it still pretty alert, even though it might have a very big wound? Is it comatose? So he's laying there, blinking his eyes, not really responding to anything else? Or is he more stuporous, where he's responding to things, but is definitely a little bit slower, not quite all there? Being able to assess what this mentation is will help to give the veterinarians more information when you call and let them know what's happening. Assessing the capillary refill time is a really good way to assess the circulation of a dog or a cat. And so to assess the capillary refill time, you can do it at home on yourself right now by squeezing your fingernail. It should be pink, but as soon as you release that pressure from your fingernail, it's going to be white. And then as the blood refills back into those capillaries, it's going to turn pink again. This should take 2 seconds or less. On a dog, you can't squeeze their fingernail quite as well, but you can check their gums. So we have a short video here. I'm going to play it, and it happens fast because this is a healthy, normal dog. See here. So you can see as soon as that finger is removed, the gum is white, and then very shortly after, it goes back to pink. I'll play it one more time. And there it's already back to pink, less than a second. And this is normal, and this is a sign that there's good circulation that's moving through the body. You're also going to want to take a look at the breathing. Is the dog or cat breathing very heavily? Is it breathing very shallowly? Are they panting? Or does it seem like they're struggling to breathe? Are they breathing, pretty relaxed? Or are you hearing a lot of rasping when they're breathing? This is information that's going to help you to decide how serious the situation is, and also help you to convey the seriousness of a situation to the vet office. You can feel for a pulse, but again, only if it's safe to do so. There are 2 places where you can feel. One is on the back, on the inside of the thigh. This is the femoral artery. And you can use 2 fingers and just sort of gently press on the middle, the inside of that back thigh, and you'll feel some slight pulsing there. And you should feel nice, normal, steady pulse. If you're feeling it really, really fast, if you're feeling it very faint, it can be an indication that there's something more serious going on. You can also check a heart rate by just keeping your hand over the lower part of the chest of a dog or a cat. You can feel their heart beating against their ribs right there. Again, should be a steady pulse. You don't want to feel it very fast. You don't want to feel it very, very fluttering. Those can be indicative of a more serious situation. And so generally doing all of these things together will help you to create a slow overall evaluation and a picture of what's happening with your dog. And so starting consistently from the head, working all the way through to see everything that's happening on your dog. And then you can call your vet and give that information. And so when you're communicating with the veterinary staff in the vet field, we use what's called a signalment to talk about what type of dog or what type of patient we have. And then we organize the information in a way that gives us the most important information first. So when you're talking to your vet staff, you can communicate this to the receptionist, to the nurse, whoever's picked up that phone, and this will help them to understand what's happening in that situation and what they might need to do or be prepared. So you're going to want to talk about the species, the breed, age, the gender, the weight, and the number of animals, if there are multiple animals that are involved, exactly what you're seeing and how long it's been going on, and then any other relevant information after that. So if they've eaten something, you're going to want to have that packaging, how long has it been going on, and then what you may have tried already at home so that they can be prepared for that as well. So if we're ready, let's get started on talking and working through some emergency cases. And this is where things might start getting a little bit squeamish or a little bit gnarly. And so let's talk about our case number 1, which is Netflix and not so chill. So it's Thursday night and you're catching up on Bridgerton. You're contemplating renaming your dog Diesel to the Duke, because it's the Duke, who's curled up right next to you on the couch. And suddenly Duke kind of stumbles off the couch, and this is what you see. All right, so we're gonna stop our video right there. We're just gonna take a moment because these are really scary, and we're gonna talk about exactly what just happened there. And so what exactly is happening? This is a seizure, in particular, a grand mal seizure. And so a seizure is sudden and uncontrolled movement of the body, which is caused by abnormal brain activity. And so essentially, there's abnormal activity in the brain, the neurons are firing off signals, and they are not connected or coordinated in any way. You see 3 different stages surrounding a seizure. So you have the aural or the pre-ictal stage, which is what you saw before when the husky Diesel jumped off the couch and is standing there, knows something that is not quite right. You have the ictal phase, which is when you'll see lots of movement, lots of paddling, the actual seizure. And then you have the post-ictal phase, which is the post-seizure phase, where their brain is coming back online, they're recovering from a pretty significant event. There are lots of different types of seizures. There's a grand mal seizure, which is like what we saw in this video. You can have a petite mal, where there's just sort of a loss of consciousness and a loss of connection between the environment and the brain. You can have a focal seizure, which might just be a paw twitching. It might look like they're chewing gum. It might look like they're biting at flies. And it's just affecting a very small group of muscles. And any of these types of seizures can occur as either one single isolated event or a cluster where there are multiple seizures that are happening a couple times, more than one time within 24 hours. And so pets may or may not seem conscious or responsive. They might urinate, they might have a bowel movement. Seizures can look like a lot of different things. And they can be very mild or they can be very severe. And the seizure that we saw just now is a fairly severe seizure. So there are a lot of different causes of seizures. They can be caused by liver disease, by kidney failure. If organs are not functioning correctly, toxins build up in the body. It can be caused by cancer, especially brain tumors. It can be caused by some type of injury to the brain. And then sometimes if an animal has eaten something that they're not supposed to, and that toxin can cause seizures. Diabetes, where a dog is unable to regulate their blood glucose, if they've been receiving insulin or if they haven't gotten the insulin that they needed, can also result in diabetes, or can result in seizures. And then the last and probably the most common cause of seizures is epilepsy, or idiopathic, which means we just don't really have a good cause. Age and the medical history are very critical to helping to determine what the cause of the seizures are and then guiding the next steps. So typically a pet who's under 3 years of age and is otherwise healthy is going to have idiopathic epilepsy. So that might be this the Shih Tzu Husky mix on the bottom, young, healthy dog. You wouldn't expect him to be suffering from kidney failure or liver disease. A pet who's over 5 years old, who's having a seizures, is likely having these seizures secondary to something going on with their kidneys, their liver, or some type of cancer. An example of that would be that Pomeranian up on the top, who definitely has some other things that are going on. So if you see a seizure, what are you going to do? The number one thing is to remain calm. We want you to record the start and the end time of the seizure, and if it started with a certain body part. And if you remember in this video, the owner of this dog commented that she could see it starting with his eye twitching, and then the seizure spread from there. It can seem like a very long time, but recording the length of time of the seizure will help to determine what you need to do next. If the seizure is happening somewhere where they could get injured, then you need to try and protect them from getting injured. So if it happens near a pool, you want to at least stand or create something that's not going to allow that pet to fall into the pool and complicate the fact that they're having a seizure. If it happens at the top of the steps, you want to be able to block the top of the steps so that they're not going to fall down and injure themselves further. You want to remove other pets from the area, because when an animal is recovering from a seizure, they're not going to be quite themselves, they're not processing things quite right, so they may become very aggressive, or they may start a fight with another dog or another cat. And then you also want to really protect yourself from being bitten. And so in this video, again, this dog was having a seizure, and had that owner gone up to that dog and tried to hold him, tried to restrain him in any way, she would have put herself at significant risk of being bit, because Diesel doesn't know what's happening and he has no control over anything. And so then the owner would have to deal with a potentially serious dog bite, as well as, you know, her dog is still having a seizure. So if a convulsion is lasting over 3 minutes, then they are at risk of getting hyperthermia. So their muscles are moving so much, their temperature starts going up, and then you're worried about significantly elevated temperature. So you start cooling the pet with some water on the ears, on the belly, and on the feet. And then you need to take that dog into the vet, because you don't want that seizure to continue going on. If the seizure lasts less than 3 minutes, and then the pet recovers and seems alert and is acting, you know, normal, maybe they're very hungry, maybe they go and drink a lot of water, you need to call your vet, tell them what happened, and then take further instructions from them. And then if you see 2 or more seizures in a 24-hour period, you want to seek veterinary attention. So even if it's a short seizure that only lasted 30, 45 seconds, and then the next morning you have another one, you need to seek veterinary attention, because that's a sign that maybe something very serious going on. And then if consciousness is lost or the pet is not breathing, you need to begin CPR. And I will not be teaching CPR on this course. There are some really great online courses if you want to follow up on it. We'll put those links available at the end. But this is a case where you would begin CPR. Number one, though, remain calm. A couple things that people will sometimes try to do, so you can spread the word not to do this during seizures. Do not start yelling, screaming, or becoming hysterical. If you're making a lot of noise and commotion, as your dog starts becoming more aware of the surroundings, they're going to panic even more. Do not place your hands near the pet's mouth. One of the most common misconceptions is that they'll swallow their tongue, so you need to pull their tongue out. It is physically impossible for them to swallow their tongues. At worst, you'll see them bite their tongue, but if they're biting their tongue, they're also at risk for biting you. Do not try to move your dog's tongue. And then don't try to slap, throw water, or attempt to startle your pet out of the seizure. These seizures are scary for you, they're scary for your pet. You can't startle them out, and you're only going to scare your pet further. There are a couple of special considerations. If you have a toy breed, so really small Maltese, Yorkie, or dog that has diabetes, hypoglycemia, very low blood sugar, is a much more common cause of seizures. So as soon as the pet is able to stand, you want to offer a small meal. If the dog is non-responsive, or it's vomiting or continuously seizing, then you want to give them a little bit of sugar to get that blood sugar back up, rub some honey or some syrup on their gums, and then take that dog immediately into the ER. So when it's time to call your vet, remember how we're going to give them that information? We're going to talk about the species, breed, age, sex, weight, and the number of animals that are involved, what's been happening and how long, and then any other relevant information. So for example, in this case, you would want to say, my dog Diesel has just had a seizure. He's a 3-year-old neutered male husky that weighs about 70 pounds. This is his first seizure and it's lasted for 2 minutes. He's standing, but now he's stumbling when he walks. So then the vet office can ask you additional questions, but you've given them all the information that they need to now assess the situation and see what they need to do next. Sometimes they may have you come in right away. Other times they're going to have you monitor and they may have you wait until the next day. And so if the seizure doesn't stop after 2 minutes, if it's lasting longer than 3 minutes, or it starts again, go to emergency. Grab your records and move your pet. So wrap them up in a large towel or a blanket, put them in a box, or if it's a larger dog, you can use a big carpet or a big blanket, wrap them up in that, lay them on the floor of the car, and go into your vet office right away. All right, so we're gonna move on and we'll answer some questions about seizures if anyone has some at the end, and we're gonna move on to case number 2, which is the Pasadena Bake-Off. And you've been inspired by Prue Leith and Paul Hollywood on the Great British Bake-Off to make your own tasty delicacies at home. So step 1, gather your ingredients. Step 2, cream, sugar, butter, eggs together. Add flour, baking powder, cocoa, salt. And step 4, mix in those chocolate chips. I swear I left those chocolate chips right here. Oh no, not this. So looks like our chocolate chips are gone, and we're going to talk about poisoning in dogs and cats. So poisoning is a condition in which a substance causes structural damage or functional disturbance of body tissues. So poisoning can happen from ingestion, inhalation, absorption, injection, or even application if you apply something onto the skin. So this can be cleaning products, this can be food, medications given in excess, or even a dog or cat who eats an outdoor or indoor plant that's toxic. Anything that's ingested is generally absorbed from the stomach between 30 minutes and 8 hours. Depends a lot on the particular dog and what else might already be in that stomach. So in particular with chocolate toxicity, toxins in chocolates are theobromine and caffeine, which dogs cannot process as well as humans. They just don't have the enzymes to process and break these down. So these act as a diuretic, a smooth muscle relaxant, a heart stimulant, and a blood vessel dilator. And so the amount of chocolate that a dog can eat can vary dramatically with the type of chocolate and the weight of the dog. So a milk chocolate Hershey bar or a couple Hershey Kisses may not be a big deal, but a package of deluxe dark chocolate truffles from Switzerland is going to pose more of a problem. These symptoms can range from mild, just a little vomiting, a little diarrhea, a little increased thirst, to very serious, including heavy panting, seizures, muscle tremors, or in worst cases, even heart failure. So if your pet has eaten chocolate, you need to call your vet. So you're going to give them the species, the breed, the age, sex, weight, and the number of animals involved, because sometimes if you have more than one dog, you're just going to find a package and you're not going to know exactly who actually ate that package. You're going to talk about the symptoms, the duration, and then how long ago it was, any other information that you might be able to give them from the package. This would also be a great opportunity to call the Pet Poison Line or the ASPCA Animal Poison Control Center, and they'll get a case started for you, start telling you what to do in those initial moments. If you're taking your dog into the vet, grab that package and bring it with you. Even if it's chewed up or destroyed, they'll be able to look at that package and get more information or find a copy of that package online to help determine how serious the situation is. So because chocolate depends so much on the type of chocolate and the type of dog, it can be really difficult to predict exactly what those symptoms are. So they have online tools, chocolate toxicity calculator, where you can go online and you can actually put in some of this information to help get a sense of how serious the chocolate ingestion is. and what are some of the symptoms that you're actually gonna be expecting to see. So you can go online. This is an example of one. You can find multiple, but they're all calculating out the amount of toxin that is in that chocolate. So we're gonna go online here. We're gonna put it in for Cassidy, that giant schnauzer we just saw who ate that chocolate. So Cassidy, and Cassidy, she's a pretty big girl. She weighs about 85 pounds. And she ate here, we're gonna choose our type of chocolate, which was dark chocolate chips. And that was a 12-ounce package. I was eating some of those before, so we have about 10 ounces. Lots of different types of chocolate. If you're not sure, they'll give you options to help you determine how much. Then we're gonna calculate that toxicity level. So that size dog with that type of chocolate and that amount, looks like we're expecting to see some mild to moderate signs. So vomiting, GI upset, hypertension, restlessness, hyperactivity. So the next steps really will depend on that amount that was ingested and the size of the pet. So recommendations might include to monitor. In some cases, you may need to take your pet in immediately. And in some cases, depending on where you are, how far away the vet is, the recommendation is going to be to induce vomiting or follow up with some activated charcoal. Although activated charcoal is falling out of fashion because there's certainly some risk with it as well. And I really want to stress that every situation is different. If your pet has eaten chocolate, we are not giving you medical advice or telling you to induce vomiting in your pet during this webinar. There are risks to inducing vomiting. So you can really complicate these risks. And you do not want to induce vomiting if it's a petroleum product. So dogs will eat some type of Vaseline or a motor oil product. If it's a strong acid or a strong alkali, like a lot of cleaning agents. If it's been longer than 3 hours since they ingested it, you're probably not going to get them to actually bring up the toxin. And then if your pet isn't alert enough, if they're unconscious, if they're not able to stand or they're having trouble breathing, you do not want to induce vomiting. So if the poison line tells you or your vet tells you to induce vomiting, your next steps are going to be to give your dog a small meal. You want to give them a lot of food in their stomach in order to help them be able to start throwing up and actually bring up that toxin. So you're going to give your dog the recommended amount of vomiting agent using a syringe. So hydrogen peroxide is the typical one that people have at the house. And then you're going to walk your dog around the yard and you're going to watch for vomiting. And once they've actually vomited, go ahead and collect that vomit in a Ziploc bag or in a poop bag and take it into the vet office with you. Veterinarians are not shy about looking at the vomit and digging through to make sure that that dog has thrown up everything that they need to. Okay, and so we're going to move on to case number 3, which is everything is coming up roses. And so during quarantine, your houseplants have really been thriving with all of the extra attention that you've been giving them. They're starting to get a little big for their pots, and so you're outside in your yard putting them into your garden. And Princess, as cats tend to do, is walking around the yard, inspecting and really supervising your work to make sure it's up to snuff. So she's out of sight, and all of a sudden you hear and so, well, I guess my image didn't come up, but we definitely heard that something happened to Princess. And so it sounds like a snake bite. And if you're in Southern California, this is maybe not that far-fetched of a situation. And so snake bites are common and can happen when you least expect them. So what do we actually know about snake bites? So we know the severity depends on the type of snake, the age of the snake, and the size of the pet. Most pets that are bitten by snakes will survive. And I think this is really important because snakes have a lot of myths and a lot of negative feelings around them. And so most pets who are bitten really do survive. There are 3 different types of venom that snakes have. And it's a really complex combination of enzymes, toxins, and non-toxic substances. So cytotoxins, some snakes have a heavier concentration of cytotoxins, and these ones destroy most or all of the cells that they come in contact with. This will lead to localized necrosis or dead tissue. Some of these toxins will target the heart, will target the kidneys, or target the muscle, but most of this damage is going to occur right at the site of the bite. The second type of venom that snakes have is a neurotoxin. And so this is a toxin that's particular to the nervous system. So this interrupts the transmission of nerve signals, which leads to paralysis, which then leads to respiratory difficulty or in some cases death. For the last type of toxin is a hemotoxin. And so this is a toxin that affects the blood. This affects blood clotting, it destroys red blood cells. So this leads to kidney failure and leads to the body's inability to clot. And so you end up with a lot of problems in the body because your blood is now abnormal. Some snake venom can work right away. Others is delayed depending on the way it was given by sometimes days or can show up much later. So when we're treating snake bites, the initial treatment that we do is really important. Our goals is to really keep the venom from circulating in large quantity throughout the body. But we don't want it to be contained all in one area. So we want to spread out that necrosis or spread out that effect without having it go too fast. We want to neutralize the venom via an antitoxin. And the main thing that we're going to do is provide supportive care and pain management because snake bites are painful. If your pet is bitten, we assume that the bite is venomous and recommend that you seek attention right away. So, if your pet has been bitten by a snake, what are you going to do? First off, this is a painful condition, and when you touch it, your pet is going to try to protect them from experiencing any additional pain. So you want to muzzle your pet so that they don't bite you and create additional trauma on top of everything else that's going on. You want to try to immobilize the part of the animal that's bit, keeping below the heart level if possible. So don't let your pet run around. Don't have your pet start jumping around. Don't force your pet to walk around. You really want to have your pet be laying, keeping quiet, and trying to move as little as possible. You want to keep your pet calm and yourself calm. We want to make sure that we're not having the toxin or the venom spread any faster than absolutely necessary. And it's going to spread faster with a faster heart rate and with elevated activity. So if you're stressing your pet out because you're very stressed, you're making it worse. You want to seek vet attention immediately. And then if you can, ID or photograph the snake if it can be done safely. Some things that we do not want you to do. Do not bring the snake to the vet office. That will create a different type of commotion and definitely delay care to your pet. Don't cover up the fang marks. You don't want to put a lot of pressure over that area. It's painful. Don't spend time trying to capture or kill the snake. And don't manipulate that bite more than necessary. Again, this goes toward the fact that this bite is painful. We don't want to increase circulation any more than necessary. Don't let your pet run around freely, so put them on that leash and keep them contained in a carrier or in a box or on a short leash if they're larger. Don't pack it in ice or don't apply a tourniquet. We need that toxin to be able to circulate slowly. If you keep all the toxin in one area, you're making that bite a lot more painful and creating a lot more localized trauma. That's going to be much more difficult to treat. And then don't administer any medications. We want to make sure that as soon as they get into the office, they haven't been given something that's going to interfere with what we need to give them. So in California, I like to do a lot of hiking, and there are a lot of snakes out in the mountains. So one question that we get a lot is, what do you do if you're hiking and you're not right next to the car and you can't immediately take your pet back in? And so, not doing a product endorsement, but I do want people to know that this product is out there. This is called the Airlift by Fido Pro, and it's essentially a fold up backpack for your dog that you can keep tucked in your backpack or take with you, and then fit your dog into the strap and then carry it on yourself. so that if you are 10, 15 miles away from your car when your dog does break a leg or gets bit by a snake, you can actually carry your dog out and get them to safety and to the care that they need. Okay, and so we're going to move on to our last and final case, which is Hello Mavis. And so you've just come home from a really long day at work. You're looking forward to taking off your mask and greeting Mavis at the door and relaxing with her. So you open the door and this is a little weird. Mavis isn't there to greet you. Instead, you find her curled up in her bed, wagging her tail a little bit. And so, you know, when you go to take her for a walk, she stumbles a little bit and she just seems very tired and kind of reluctant to go with you. Something seems kind of off. And so, is this an emergency? And so, we're not really sure exactly what's happening with Mavis. So we're going to start by examining Mavis pretty slowly. We're going to look at her mentation and she seems kind of stuporous. She responds, but she's not really quite herself. We're going to assess her capillary refill time again by pressing on her gums and looking to see how quickly those gums return to pink. We're going to look at her breathing, see if she's breathing hard, is she panting. You would be very concerned if you saw that she was panting. She's just laying there sleeping. She's not exercising. You're going to feel for some pulses. So check, make sure her heart's still beating pretty steady. Can you feel pulses in her back legs? Just kind of do that slow overall evaluation. Does she have any wounds? Did she hurt herself during the day? Let's see what's going on. And so we're checking Mavis's gums and her capillary refill time. Remember, it returns to pink 2 seconds or less after you push it. And so if the gums are abnormally colored, it can indicate a lot about the underlying health status of a pet. So pink healthy gums are right here, but gums that are yellow might indicate that there's something going on with the liver. Gums that have kind of a brownish color may indicate that there's a problem with the blood. Gums that have little pinpoint bleeding can indicate that there's problems with the clotting. So they get what we call these petechial hemorrhages. All of these are signs that there's something abnormal going on in the circulation. And so when we look at Mavis, we see that her gums look really pale. And when we push on her gums, we see the white, but it doesn't really go back to pink because they're already so white and so pale. And so when you see white gums like this, there are 3 main causes. All have to do with circulation. The first cause is that they've lost a lot of blood. So they've bled out, and so there's no more blood in their body to actually circulate through their system. But we know that's not what's happening with Mavis because there's no blood in the house. There's internal blood loss. So sometimes if there's some sort of condition going on internally in the abdomen, they're losing blood outside of their circulatory system, but you may not see it from the outside, but that blood is no longer able to circulate. And then if there's absent or severely decreased blood flow, either due to some type of reaction, and the capillaries and the blood system is no longer able to allow blood to flow through, normally you'll also see very white gums. It doesn't actually really matter what the cause is in this case. When you see white gums that don't refill and turn to pink when you press on them, this is a medical emergency. So what do? You're getting on the phone and you're calling your vet right away. You're giving the species, the breed, the age, the sex, and again, the number of animals, in this case, just one. How long you've been seeing what's happening and exactly what's happening. And then you're putting Mavis in the car and you're going to start driving to the vet right away so that she can start getting the life-saving care that she needs. There's nothing you can do at home in order to help. The best thing you can do is recognize that this is an emergency and take your pet in immediately. Okay, and so that completes all 4 of our cases today. And so I hope going through some of these cases and learning a little bit about some of these emergencies will help you to be better prepared if you ever happen to need to face this emergency. And really what you do in the moment can save a life, whether it's finding that phone number quickly, having that now empty bag of chocolate chips at the office, or just knowing that you need to take action right away. There are a lot of great resources that are online. And again, this is where you can go for the CPR classes at Veterinary Partner or the AVMA, the American Veterinary Medical Association. And they'll continue to explore other emergency options. Really hope that today everyone's learned to identify some of the basics of the emergency, and feels a little bit more confident to at least look at the next emergency and help decide what to do next. And so I think we're gonna open it back up for Michelle to take some questions, if anyone has questions, and thank you everyone for joining us.
Dr. P, that was some amazing information that you shared.
Yeah, thank you.
So
all important information, I think.
So if you're ready for some questions, I've got some from the audience.
Okay.
So what are the most common emergencies that you see for dogs?
So the most common emergencies that we tend to see are going to be a little bit dependent on where you are and what time of year it is. I think in the summer months, especially when it starts to get a lot warmer, one of the most common emergencies that we'll see are people who have left their pet in the car for just a couple minutes while they're running into the store to grab something, not realizing that that temperature in the car is going to get really, really hot. Or people have decided to go hiking or go for a walk with a dog who's maybe not in perfect shape, maybe a little overweight, a little slower. And in Southern California, it can be 115 degrees. And so suddenly that dog is overheating. I think overheating is a really common one. Also in the summer months, bee stings tend to be really, really common. If they step on a bee and they hurt and they're yelping, or they have an allergic reaction to a bee.
Okay, and then what about for cats?
So for cats, I think the most common emergencies that we see are sometimes cats who chew on wires. So they chew on electrical wires and they may electrocute themselves from that. Or cats that tend to eat things that they should not have eaten. There are a lot of plants that people keep in their house that they may not realize are toxic. Or if cats are out hunting and they come across a mouse or a rat that's been poisoned, cats tend to get poisoned from eating things.
Okay. What if your cat eats a poisonous houseplant? If they regurgitate that plant, is it enough to get the toxicity out of their system?
So in a case like that, it depends what type of plant they ate, how toxic it is. Some plants are mildly toxic, some are very, very toxic. So if they ate a plant and then vomited the entire plant out right away, probably not that big a deal. If they've only vomited out part of that plant and they still have some of it, they can definitely still show some signs of becoming poisoned. So if your cat has eaten anything poison or eaten a poisonous houseplant, you really need to take your pet in to make sure that they vomited all of it out, and then give them some supportive care, give them some things to prevent them from absorbing anything that they haven't vomited out.
Okay, and then you were talking about that amazing carrier when you're on a hike, but what if you don't have the ability to carry your dog back to your vehicle?
Right. And so this is one of those cases where being prepared, and if you're doing multi-day backpacking trips or you're doing really big hikes, this is one of those times where being prepared is going to save you a lot of heartache. Because if your dog has been bitten by a snake or has, broken a leg or experienced some type of trauma and you're that far out, you really need to figure out how to get your dog back. And so whether it's going to be, and I'm smaller and slender, I wouldn't be able to carry my 85-pound dog 15 miles out. I just physically can't do it. And so then it's, just really keeping your fingers crossed and hoping for the best, and it may be a really poor outcome. In other cases, you prioritize and you carry your dog back, as quickly as you can, call for help, leave your dog there, go back to the car. But I mean, none of those situations are good. And that's where I think being prepared is really important.
Okay. We have time for just a couple more questions. So what if your dog steps on a bee, but they don't have any reaction to it?
Yeah, and so if the dog steps on a bee and they're painful, or they're limping a little bit, but there's no other reaction, then you can go and you can remove that stinger. It'd be the same as though a child or yourself got stung by a bee. But there's going to be some local irritation. You want to remove that stinger carefully with tweezers, or you can use the edge of a credit card, and then just watch. Make sure that there's no swelling, there's no trouble breathing, that your mentation is staying the same. And you probably don't actually need to do much more than that. If you're noticing though that a half hour, an hour later, that the eyes are looking really red and swollen, or the nose is really swollen, then that's going to be more of an emergency, and then you're going to want to call your vet.
Okay. So I know you did talk about snake bites. So two things. What if you don't know what kind of snake it is? And then two, what would you do if your animal was bitten by another type of animal other than a snake? Let's say a squirrel, a raccoon, a coyote, because we've got those here in Southern California.
Okay, so I'm going to start with the snake bite. So if your dog or your cat is bit by a snake and you don't know what kind of snake it is, and this actually happens more than you might expect, because you may not, if your dog is out in the yard and then they come in and then you see two fang marks, that snake is already gone and you're never going to know. The majority of the care that we do for snake bites is supportive care. So it doesn't actually matter what type of snake it was. You're giving them fluids, you're making sure that their circulation is really good, you're managing a lot of that pain, and then a lot of those clinical signs that might happen. If they're having trouble breathing, you're going to support their breathing. They're having problems with their blood, you're going to help to support their blood, either through a transfusion or something. All of that is just based on what you actually see. And then you can also, based on your area, what is the most common type of snake that might be there, and you can base your treatment on that. You won't, if you don't know or have a really good idea of what type of snake it is, you won't be able to give that anti-venom. And you just have to manage treatment without that. But in most cases, you can take a big guess, and the majority of that care is supportive care. So even if you don't know what kind of snake it is, you're still able to treat and save that pet. If your pet is bit by something else, it depends, again, the seriousness of the bite. If you have a small Chihuahua who's been bit or attacked by a coyote, that's probably pretty serious, and you need to take your pet into the veterinarian right away to be evaluated. If you have a larger dog who's bit by, a squirrel, was chasing a squirrel and got bit, or something like that, that injury may be a lot less serious. So this is where doing that really careful exam of your pet, what's their mentation? What does that injury actually look like? How are they breathing? How are they acting? Is going to help you determine how quickly you need to take your pet in.
Okay. And then the last question that we have is, what if your pet swallows glass? Are there any types of, I guess, remedies that we can use to assess this situation? I mean, even like if you don't see any signs of blood or.
So that's a good question. And at first it might seem silly that, like, why would a dog eat glass? But dogs really do eat everything. So it depends on the type of glass. If they've eaten a glass marble, probably pretty little risk. If you've dropped a jar and it's smashed and there are pieces of glass and they're licking up that sauce and they ingest some of that glass, the severity is going to depend, on the size of those pieces, the edges of that glass, and you worry about it, potentially cutting or creating trauma on the inside of the GI tract. In a case like that, we usually recommend feeding some food, either some bread or some dog food, something that's going to coat all of those sharp edges. And then you need to call your vet right away and then explain to them what happened, and then they can make that determination for that specific situation, whether you need to have them try to throw that up, whether that glass needs to be removed, whether that's surgery or other procedures. But that's probably pretty situational. But in that at least initial moment, giving them food to help put more substance in that stomach and protect those edges can be helpful.
All right. Well, thank you so much. That was actually really good information for myself because I have a cat and a dog who are super nosy when I'm in the kitchen because they think everything is for them.
Yeah, and it's incredible how some dogs seem to really attract emergencies, and other people will go, for a dog's entire life or a cat's entire life and never have any problems. You just never know when it's going to happen or when you're gonna need to have this knowledge.
All right. So yes, I'm going to practice trying to stay calm.
Right.
I think, that's the number one thing in any emergency that is to try and stay calm, but sometimes you just want to go. So, because our pets are like our babies.
For sure.
So, thank you so much for all of the information today. I hope everybody out in our audience enjoyed the presentation. If we didn't get a chance to get to your question, you can go ahead and send those to outreach@pasadenahumane.org, and I will make sure that Dr. P gets to them. If you did enjoy this webinar today, please think about making an impact so we can continue to host these webinars and Dr. P can continue to do the amazing veterinary work on, the shelter animals and community animals as necessary, and use that donation link that I put in the chat box. And remember, all of your donations for the month of April are doubled. So thank you, Dr. P, for taking time out of your busy day. I'm sure that there are animals in the shelter that need your attention now. And all right, and we'll see you next time. Bye.